So good afternoon, everyone, and welcome to our webinar today. Thank you for signing up. We had a tremendous response for this webinar, which is exciting. So my name is Tanya Newell. I am a workplace consultant with the Workers' Compensation Board of Nova Scotia. My role with WCB is to help support employers in Nova Scotia on injury prevention, strengthening safety culture, and overall return to work management. I am not a caseworker who deals with the individual claims of your injured workers, but I can help support organizations with the development of effective return to work programs, helping to identify transitional duties for workers, as well as assist in having a better understanding of WCB and how to navigate the WCB system. It's a somewhat complicated system, so I'm here as a support. And I am one workplace consultant within a team of 9 other workplace consultants and our ergonomist. And we're here as resources to you, the employers of our province. You may have noticed that we will be recording this session. This is our 4th prevention webinar this year, and I encourage you to go into the WorkSafe for Life website, and if you go to the injury prevention tab and go all the way to the bottom, you'll see the other webinars that have been recorded by some of my colleagues. So we started with an overview of due diligence and the internal responsibility system. Then we had a session on safety training to support safe work. We had a session on rate setting, and today we're going to talk about risk mapping. So as the question came up about the video and the mics. We do have the video and mics muted. It just helps to ensure that the presentation runs without glitches. Hopefully it will help. In the background are 2 of my colleagues, both workplace consultants, Paul Donovan and Stephen Vigneault, who are going to monitor the chat. So if you have any questions at all, please type them in the chat and Stephen and Paul will answer them, or we can save some of the questions to the end. I have built time in for a question and answer portion at the end of the session. So I won't be filling the entire time, so we'll have some time for questions. Okay, let's get started. So I do want to start with a land acknowledgement. So I want to take a moment and state that at the Workers' Compensation Board of Nova Scotia, we acknowledge that we are in Mi'kma'ki, the traditional unceded and current territory of the Mi'kmaq. We are all treaty people who benefit greatly from the shared resources of this land covered by the treaties of peace and friendship. As the province's provider of workplace injury insurance, we are grateful to work on this land. We are committed to building trusted relationships with Indigenous peoples, to learn about their community, to better understand their history from their perspective, and to help us provide exceptional service to all Nova Scotians as we work towards reconciliation and equity within our community. So now let's look at the agenda for today. So here's our agenda for the session. As I mentioned, this is the 4th webinar. So risk mapping is the 4th webinar in our prevention series. And I chose to speak about risk mapping as a way to create a visual representation of where hazards may exist in your organization. It's a really simple concept, but it can help shed light on where an organization can focus their prevention efforts to have the greatest impact. This tool can be used in 2 different ways, both reactively and proactively, and I'm going to talk about both ways to use it. And many of the tools and resources that you need are things that you probably already have readily available or are really simple to create. And we also have some additional tools to show you and talk about that are designed to help prioritize your findings and make the best use of time and resources. So risk mapping is something that I suggest you do on an ongoing basis. And if you're an employer with a joint occupational health and safety committee, which I'm sure many of you have, you may find that risk mapping, this tool is something that you can task your committee to use. So before we get started, I'm just going to ask 2 really simple yes or no questions. So question number 1. Are you currently regularly inspecting your workplace for safety hazards? And question 2, are you currently documenting your workplace incidents on a form of some kind? So you can just drop the yes or no's in the chat. And since they're really simple questions, we're just going to give you about 20 seconds to respond. And I don't have the chat open, so just give me a second to open the chat. Perfect. So most organizations are completing inspections and also making sure that incidents are being documented. So now let's look at a different way to look at that information. So in my slides, I'm going to show you a really simple method that can be used by any employer in any industry to help identify, assess, and control injury hazards in your workplace. This tool is surprisingly simple, although some of the additional documents that we're going to show you do make it a little bit more complex, but it's really not a difficult tool to use. Risk mapping helps to create awareness of where your incidents are happening and creates a nice visual to allow you to see where your employee safety issues are. On the slide, you see the actual booklet that we've created, and my colleague Paul will put a link to our website to share the electronic version of the booklet in the chat. We also, I do believe, still have some printed copies of the booklet. And if you wanted an actual hard copy, I'm going to share my email at the end, or I believe on our website, there's a place where you can request resources and have them mailed to you. I don't think we have a lot of the booklets left, but we do have some hard copies. So if you wanted some, we can make arrangements to get you a hard copy. Okay. So why would you use risk mapping? What are the benefits of this tool? We all want to reduce injuries for employees. Employers of our province need our workers working, and we need our workers to come back tomorrow for their next scheduled shift. Keeping them safe and healthy is one step to help ensure that that happens. Employers rather, also don't typically have unlimited budgets to put towards injury prevention. So wouldn't it be helpful to have a way to focus our time, focus our energy, focus our resources to address the areas where employee injuries are happening or where the most serious hazards are present? Risk mapping can help with that in a really simple, straightforward way. I've worked with several companies over the years who didn't know that they had what I'm going to call hotspots, or areas in their organizations where incidents were happening more than in other areas, or they incorrectly thought that one area was more hazardous than another because the employees maybe were more vocal or brought forward more issues. And I want to share a story about an employer that I was working with a few years ago. So with this one particular organization, they told me very early on in our work together that they knew exactly which department had the most incidents and had the most hazards reported, and that's where we needed to focus our time and our energy together. I convinced them to do the risk mapping process, and we looked at 3 years of injury data. And when we did the risk mapping, it clearly showed that the department that they thought was the most hazardous and had the most incidents was actually not the area with the most incidents. But until we took the time to review their incidents and plot them out, they didn't know that. And the department that did show up as their actual hotspot was a bit more remote from their other areas, and so it wasn't in their face as much as the other departments. But this risk mapping process clearly highlighted that they were having more incidents in this remote area. And then working from that information, the organization then followed the next steps in the risk mapping process, and I'm going to walk you through those. And so then they put focus on this department in a different way. They identified some injury trends, put appropriate controls in place, followed up to ensure the controls that were implemented did in fact correct the issues. And in a relatively short period of time, they saw a significant reduction in incidents from this particular department, and the staff morale also changed. So the staff in this remote work site commented that they finally felt seen and heard, whereas in the past they felt like a distant second cousin from the main family because they were located away from the main central part of the organization. So this was a huge secondary win for the organization. So they improved employee safety by going through the risk mapping process and putting controls in place, but they also had happier and more engaged employees. So this was huge for them. So the risk mapping tool provides you with a visual demonstration of where incidents or hazards are happening. And once you start plotting the findings, whether they're from your incident reports or workplace inspection reports, it can really highlight where the hazards are. Sometimes we don't put as much focus or attention on the minor or first aid type injuries, and we focus on the more serious injuries, which of course must be focused on. I'm not saying that at all. But if minor multiple injuries are happening in one area or on one piece of equipment or on one task or on one shift, that could be like a small red flag waving to indicate that there's potential for more serious injuries, or even just that multiple people are suffering small injuries that can lead to frustration for your workforce. So you want to address that. That frustration can lead to a feeling that my health and safety isn't important. No one's looking at, my issues. That can lead to apathy and complacency, and then more serious injuries can happen, and that downward spiral can happen. So using risk mapping can help identify where those hot spots are or where those areas of focus need to be. Once you know where the hazards are, then it can help you to determine where best to allocate your resources and time to address the safety hazards that are having the most impact or could have the most impact for your organization. So being able to prioritize safety control measures to address the more high risk or high frequency hazards just makes good business sense. Once you start using the risk mapping tool consistently, it can help with your tracking and trending. It can also help highlight not just your high hazard areas or high injury areas, but can also highlight other trends. Do more incidents happen with seasonal changes or with new processes or in one particular area or on one shift? When it's used on an ongoing basis, it can help determine if the introduction of your control measures that you've put in place are actually reducing the incidents or addressing the hazards. So let's look at how the ways that risk mapping can be used. So risk mapping can be used in two different ways. First, it can be used in a reactive way. So to help an organization identify where and why your employees are being hurt by looking at past incident reports, plotting where they're happening, and looking for areas to focus on. Secondly, it can be used in a more proactive way by looking at the findings from your workplace inspections or hazard reports and identifying where your hazards exist, even if no incident has yet to happen. So again, this information is plotted and we look for areas to focus on. And regardless of whether you're taking a reactive or proactive approach with risk mapping, a lot of the processes, tools, and resources used are somewhat similar, and we're going to talk about what those look like. So when you start the risk mapping tool, you need the map part. So the first tool you need is a copy of your organization's floor plan or layout. Most organizations have evacuation maps as part of your evacuation process posted, and that's a really great option to use. Some of you may be watching the webinar in a meeting room at your workplace, and if you look towards the door, very often you'll see an evacuation map posted there. Get a copy of that. Get a copy of the map or maps. Get them printed off. If you don't have an evacuation map, you can get graph paper and hand draw a layout of your facility. The risk mapping booklet that Paul posted the link to on the Work Safe for Life website shows a hand-drawn map. The hand-drawn map in the booklet is simple, but it shows a layout of a pretend organization, and it works just fine. The map in that booklet, I actually drew it, and I have zero artistic or drafting skills, so it's just graph paper with an outline. You just want to draw out the basic outline of the different spaces within your workplace and label the areas. And it's also important to include your outside spaces that employees use. So parking areas or outside eating areas, or if you have a designated smoking area. As well, you want to look at your non-working spaces within your organization. So if you have lunchrooms or a gym or changing rooms or that type of thing, anything, any spaces that would be included in your workplace inspection process should be included in your map, and any places where an employee could be injured. And I'm going to show you some samples. So this slide shows a copy of an evacuation map from a pretend company. So I'm going to talk about the reactive way to use risk mapping. So this map is simple. It shows the business areas. So you've got your production area, you've got storage and the lunchroom reception, but it also shows the parking area where the employees park and walk to the building. So in this example, we've gone through the process of reviewing their WCB claims and internal incident reports, and we created a legend to show time loss, medical aid, and report only first aid incidents. So the time loss, you'll see a gray square with a letter T. The medical aid are the darker gray squares with an M, and the report only first aid incidents are the white squares with an F. We've plotted where all of those incidents happened based on the reports. This is where your internal incident reports will help to supplement the WCB claims data download information, because sometimes the physical location may not be clearly indicated on the WCB report of injury. And we're going to use this severity legend, this time loss, medical aid, and report only in the area prioritization worksheet, which I'm going to show you on the next slide. But you can also use incident type as your legend. So you could do a color-coded legend with slips, trips, and falls maybe are green, and sprains, strains are blue, cuts are red, and so on. And I've used a color-coded method with one of the employers that I worked with, and because we wanted to see both the frequency and the type of injury and the severity, we also put a black dot in the center of the colored circle if it was a lost time, and an X if it was a medical aid injury. So you got to see both the type of injury and the severity. You can customize this tool really easily. With one organization, we used bingo daubers. They had a really large evacuation map that we used, and so the bingo daubers work perfectly. But you can go to the dollar store and pick up little colored dots, little dot stickers. They're great, or markers. Keep it simple. You just want to make sure that when you're plotting your incidents on the map, that you can clearly see what type of injury or the severity, whatever legend you're using. You just want to make sure that you can clearly see what's being plotted, and so that you can identify where your hotspots are on the map. So in this particular map, you can see the back exit area has a number of reported incidents. I'm not sure if you can see my cursor on the screen or not, but there's a number of reported incidents in that back exit area. Production area also has quite a few, and then the parking lot would be the third largest group of incidents. So now let's take a look at the next step in the process. So once you've plotted the incidents on the actual map, you then need to determine what areas require the most attention. So this slide shows the area prioritization worksheet. This again comes from the booklet. So this is filled out based on the risk map that we just looked at, and the document was created to allow you to prioritize where your incidents are happening based on frequency and severity in a really simple way. All you do is simply count up the total number of incidents by area, and then break that number down by your lost time, your medical aid, and first aid report only incidents for our example. Those categories have then been assigned a value. So your time loss injuries are assigned a value of 10, medical aid are assigned 5, and report only first aid incidents are assigned 1. So you simply do the math, multiply the number of incidents for each type by the value assigned, and then come up with a score for each, and then add all those scores together for the total score. Then it's just simply a matter of ranking them from highest score to lowest, and this gives you your priority. So in this example, although the back exit area had the most incidents with 16, it actually ends up as priority 2, because when we do the math, it's the production area with, although 6 fewer incidents, 4 of those incidents were time loss incidents, so they come out with a higher score. They come out with a score of 54 versus the 40 for the back exit. So back exit has 16 incidents but only scores 40. Production area has 10 incidents but scores 54. So it comes out as the top priority for us. And I do want to note that there is a typo on this document and in the booklet and on the website. The time loss score for the reception area, you can see, is listed as 20. It should be 10, but the final score at the end is correct at 10. But in case anyone had any questions or it wasn't making any sense, there is a typo in this document. I noticed the typo when I was preparing for the webinar, so I am going to reach to our communication folks and see if we can have that typo corrected. So we've plotted our incidents on the map. We've done the area prioritization worksheet and come up with priorities. Now I'm going to look at what we suggest you do next. So this is a sample hazard identification and control worksheet. And again, this can be found in the link that Paul provided in the chat. And we have blank samples of all of the forms and documents that I'm speaking about today in that link. So the booklet has the samples pre-populated with our diagrams and information, but there are blanks at the end. So we suggest listing the areas by priority, and for each area, determine what was causing the incident or incidents, group similar incidents together, and you can make note if there are multiple similar incidents with similar causes, and then document your controls. This information should be easily found on the incident investigation forms for each incident, and if it isn't, you should go through the process to identify ways to control the hazard to prevent future repeat incidents. And this isn't just important, obviously, for risk mapping, but it's also a required action when an incident happens. And when you're listing the controls, list both the short-term and long-term controls. Often we will have a short-term control or control that can be done right away. We put it in place. But in order to really address the root cause, we may need a longer-term solution that may require maybe additional research or additional planning, or it's a total process change. Or in some cases, it may require funding that has different levels of approval, so it may take longer to put those controls in place. But it's important to document both types of controls in order to track them to completion. In this example, you can see that in the production area, there were 2 time loss injuries for a back and a shoulder injury. One was for a tall employee and one was for a shorter employee, and both of those people were working at the same workstation. So it was determined that the workstation wasn't a suitable height for either worker. So the short-term solution was, let's raise the height of the workstation for the taller worker and provide a raised working platform for the shorter worker to stand on while working at that workstation. Job rotation was also implemented throughout the working day. So this organization also decided to create a longer-term plan to research and purchase easily adjustable workstations for this area. But due to the cost of the project, it had to be incorporated into the following year's capital projects. So the hazard was addressed with a short-term control for these 2 individuals, but the longer-term plan for the adjustable workstation would allow for any employee of any stature to comfortably work at this workstation. So in order to not lose sight of those longer-term controls, or even the short-term controls that might not be implemented right away, you want to make sure you're tracking them. And the tracking and controls can be done using a hazard control action plan, which is what we're going to look at next. So here we can see a hazard control action plan for the parking lot area in our example. So we've noted a brief description of the hazard, as well as the different controls that were identified. And people have been assigned to own the different tasks, and timelines have been for completion have been agreed to and assigned. Like any action plan, it's important to monitor the plan to ensure the actions are completed. The status column allows you to monitor this on an ongoing basis and highlight when something has gone past the projected completion date, and you can maybe put in an indication as to why that happened. You want to make sure that all staff that are directly impacted by any changes are aware of the controls that have been put in place to prevent future incidents so that they know the new way of doing things. And in addition to the staff who are directly impacted by any of the new controls, I strongly believe in the benefit of sharing this type of sheet with all staff, either through a company shared internal website or go old school and post it on a bulletin board. I really like clear visuals, so I would probably add colors. Green, it's been completed, yellow, we're getting close to the date, and red for anything that's gone past the deadline. And I'd probably add an additional column with an explanation or any additional notes on the status. There are times when things can be back ordered or there can be a legitimate delay for a number of different reasons. By sharing this information and keeping everyone in the loop, it's an important way to show your employees that employee safety is important and changes are happening to protect their safety. Communicate what's happening. You can never over communicate in my mind. It's also important to monitor to ensure that the controls that have been implemented are actually addressing the issues and haven't created new hazards. And again, blank copies of all of these are included in the link in the chat. So that's sort of the reactive way that you can look at the risk mapping tool. Now let's look at how you can use it in a proactive way by looking at the findings from your workplace inspections, your hazard reports, and identifying where hazards exist even if an incident hasn't happened. And again, you're once again going to plot the findings to look for areas to focus on. So this is the hand-drawn by me picture of a pretend organization. So this drawing shows the different areas of the business, including a second floor and a parking area. So super simple. Don't have to be an artist or a draftsman or anything like that, just basic outline of the workspaces. So in this example, we show the findings from the most recent inspection that was completed by the Joint Occupational Health and Safety Committee, and their findings have been plotted on the hand-drawn map along with some notes. The description of the findings should correspond with the findings on the actual incident or on the actual inspection report. So this can be done as you're completing your inspection or right after. I had one organization that the front was their inspection report and on the back was the copy of the map. And so they could make notes of what they were finding and plot it on the map as they were doing their workplace inspection. You decide what makes best sense for your organization. So in this example, we've numbered the hazards found, and those numbers would correlate to the findings that were documented on the inspection form. And it's important to note that if you find a hazard during the inspection that you can address right away, you do that. But also you want to make sure that you are documenting it both on the form and on the map. This ensures that you have that historical information if the hazard happens again, and will also ensure that the control is appropriate. So if you see a simple hazard and you fix it, and every month when you go out and do your inspection, you're seeing that same hazard and you fix it each time, that's identifying that your fix isn't sticking. And there's something bigger happening here that we need to look at. But if it's not, if you just fix it and you don't document it, then that information is lost. So next you would assess the risk for each of the hazards found in the inspection process. So this is the hazard prioritization worksheet. So earlier we talked about the area prioritization worksheet that we use in the more reactive way. For the proactive way, we use the hazard prioritization worksheet. So we've taken a really uncomplicated approach with 4 yes or no questions being asked. Oh, my screen went black. Hopefully that didn't happen for you. So the 4 questions are, has the hazard been reported before? So having previous inspections available help provide this information for you. Question 2, have control measures been put in place already to prevent the hazard or reduce the risk associated with the hazard? So if you find a hazard where control measures have been implemented, but the hazard is still present or an incident has happened, you should make sure to review the control measures to figure out why it isn't working. Question 3 is, are workers exposed to the hazard during regular work or regular operations? And finally, has the hazard been known to have contributed to an incident or incidents? So you answer the 4 questions and then with yes or no and tally the number of yes responses. The more yeses, the higher the priority ranking. And this will allow you to plan for the implementation of controls based on the level of risk associated with the hazards. So in this example, if we look at the parking area, you'll see that the potholes have been identified as a hazard in the past. Control measures have been put in place already, but yet it is still showing up as a hazard in the inspection. So obviously the controls did not work. Employees are exposed to the hazard in the regular working day, and there have been incidents as a result of the pothole. So with 4 yes responses, this ranks number 1 of the hazards noted in this particular inspection, and therefore it should be focused on first. From here, you would follow the same process as with the reactive risk mapping. Identify your short and long-term control measures using the hazard identification and control worksheet. From then, you would develop the hazard control action plan with your assigned people responsible for each control and the timeline for completion. And again, you would track that and monitor to ensure each action is completed and that the hazard that the control has addressed the hazard that was identified. So I'm going to wrap things up soon and we'll have time for some questions. As you've seen, the information on the risk mapping is a really simple concept. It may take a bit of time and effort to do the first reactive one if there are a number of incidents to plot, but I can speak from experience that the visual display you get at the end is so much easier to identify hotspots compared to a spreadsheet of injury reports or going through a pile of incident reports that are, paper forms. And then using that information to determine the priority using the tools I've shared will help to ensure your resources are directed towards the areas that are going to give you the biggest return. But one thing to keep in mind, like any tool, the more complete and detailed the information contained in your incident forms, the better the results you'll see when completing risk mapping. So if your report says employee fell in department XYZ and hurt back, it will be a lot more difficult to plot this incident compared to a report that says employee was working on the ABC line and was piling boxes from the end of the conveyor to the pallet that was 8 feet from the end of the line and slipped on waste plastic wrap on the floor, falling and injuring back. That description would allow you to pinpoint exactly where the incident took place, whereas the first description really only narrows it down to a department. So the better your information, the better you will be able to do the risk mapping process. And that's part of the reason why if you're doing the proactive approach and plotting the information from your workplace inspection reports, doing it at the time, you'll be able to actually pinpoint where your hazards are. This tool can be used in any workplace or any work area. If you have a large workplace or multiple locations, you can have different maps for each location or different maps for the departments or the floors. It's very, very customizable. As I mentioned earlier, you can plot incidents by severity. You can plot incidents based on the type of injury and then denote if the injury resulted in a lost time or medical aid claim. You can also focus just on one type of injury. This tool was created as part of our slip, trip, and fall campaign a number of years ago, and it was solely focused on slip, trips, and falls. But myself and some of my other colleagues said this could be used for all types of injuries. It doesn't need to be, focused on one thing. So we sort of made a second version, and it's for all incidents. But you can focus on one type of injuries. Employers who maybe are looking at enhancing their ergonomic prevention program may decide to do risk mapping looking at musculoskeletal injuries as a starting point. It's very customizable. You can take this and make it work for you. And the other really great thing about risk mapping is how the Joint Occupational Health and Safety Committee can be involved. I encourage employers to have their JOSH committees complete risk mapping at each month's meeting. When they're reviewing their incidents, plot them on the map. Start a new map each year and do comparisons. They can then clearly see if the controls that have been implemented have made a difference or what is the new area that we need to focus on. If the proactive approach is the route taken, then again, it should be used on a month-to-month basis. Are identified hazards being controlled, and are the controls working? This isn't a one and done process, but in order to have and create sustainable change, it really should be incorporated into your regular safety activities, or at the very least done on a yearly basis if you're looking at your incident reports. But I strongly encourage employers to take this as a tool that they use on a month-to-month basis, and the JOSH committee is a great group to get involved with this. So we're almost finished. The webinar will be posted on our website probably within the next week. So if you want to share it with any colleagues who maybe weren't able to attend, and I've also included my email, so if you have any additional questions that you'd like to reach out to me directly about, please do so. If you wanted to have a hard copy of the booklet, you could send me an email and I can see what we have and get those mailed out to you. And I want to remind you to watch your email inbox for information on the next prevention webinar. That one's going to be held on October 22nd, same time frame, 12 noon to 1 p.m. And the topic is making ergonomics stick, bringing lasting change to workplace safety, and will be hosted by our ergonomist, Sean Budden. So we do have lots of time left. So Paul and Stephen, I've had the chat closed. Are there any questions?
Hey, Tanya. Yeah, there is a few questions.
Perfect.
I'll start off with Jasmine. Most of our incidents and near misses happen at residential job sites, not in our own facility. Sorry, it just jumped on me. Do you have suggestions or examples of how field service companies can adapt risk mapping to track hazards across many different locations, and what's the best way to track them? And kind of add on to that, Denise used home care as an example in terms of changing work environments and how you could use the risk mapping tool.
So you could do like a basic outline of the facility that you have. If you're having multiple incidents in the same home, then like plot where those are happening. Or if you have someone who is traveling to multiple homes, again, take a basic outline of the home or the facility and look at, are all the incidents happening in, say it's the laundry area, and we're finding some trends that when laundry is on the second floor of like a home care type setting, that we're seeing a lot of reports of incidents from laundry in the second floor. So let's kind of hone in on that. So it would be a little more challenging for sure, but I think you could still do a basic layout and just again look at all your incident reports, and is everything coming from the same area within that facility, or are we seeing similar incidents in multiple locations? So everything is happening in the bathrooms, or everything is happening in the kitchen areas, and try and identify the trends that way. It is a little more challenging with workplaces that are not stationary. But great question.
So another question we got, you gave an example of a pothole. The participant was asking if they do not own the building or property, and they may have advocated for maintenance to fix it, but they don't really have control on it. What should the next steps be? I did post CCOHS's hierarchy of control and mentioned the administrative control, but I thought maybe you can jump in as well.
Yeah, I mean, if you don't own the property, then whoever does own the property, you want to make sure that you're escalating. If you've had incidents or hazards are being identified that are owned by someone else, you want to escalate that to the organization that does have ownership over that. If you're not getting any response, and if there's some way that you could sort of cordon off or keep your staff from having to travel over that, I mean, that might be a control that you have to put in place. But I would escalate that to the ownership of the parking lot, or the, in this case, the pothole, the whoever owns that property. I would escalate that to the owner of the company and let them know, because they do have an obligation to protect the safety of people at or near their workplace. And if they own the property, then they have some ownership of that. So I would definitely escalate that up.
Okay, I got another question from Al. Should employers do both reactive and proactive risk mapping, or does it depend on the needs of the organization?
I would suggest that both be done. The reactive is a great way to kind of see that historical picture. But on an ongoing basis, I think the proactive is important to be able to identify what could become an incident and address that before it happens. But the reactive gives you that historical picture and allows you to see that, did your controls actually address things going forward? And doing the reactive, maybe you do the reactive on an annual basis once you've got things sort of under control, but the proactive, I think, should be done on a regular monthly basis. But again, it's what makes sense for your organization. If you don't have a lot of incidents, then the reactive one might not make as much sense.
So we have a question from Gail. Tanya, can you comment on using typical considerations such as likelihood and severity of a hazard to help identify priorities in this mapping tool?
So in the reactive one, by plotting how many incidents you've had, you're seeing, the frequency of those incidents and the severity. So again, when we look at categorizing things as lost time, medical aid, first aid, you can even do your close calls or near misses. That helps to address the severity of the incidents that you've had. For the proactive, and I'm just going to go back to the proactive. So in the proactive hazard prioritization worksheet, again, you're asking questions on how, are people being exposed to this hazard? Have we had previous incidents? So that helps to speak to the frequency of the hazard, and the prioritization, helps you identify the priority of how you're going to address the hazards that have been identified. Does that make sense?
Okay. Let me see here. There's just comments, so I'm just reading through. I think Jasmine, who asked the original question about changing workplace, for her workplace, they typically work at a home for one day and then don't return. So it's kind of like a one-day project, but I don't think I think your answer still applies in terms of map out a general area and where are you most likely to get it if you're working on I think it was homes in that particular scenario. Mm-hmm. And then will there be a component added, I guess this means to the risk mapping tool, to include a maintenance check to ensure regular maintenance schedules are being completed and equipment maintained? This should also be included in both incident reports and inspections.
That's a great idea for an addition. And again, the tool is very customizable. So if you wanted to add that, I would absolutely encourage you to add anything that you can do to enhance the slide, or enhance the process to better suit your needs. Absolutely. Yeah, make it work for you.
And then just Jasmine added, would using a standardized home risk template with zones like driveway, attic, basement, and roof be considered a best practice for tracking hazards where there would be not a consistent environment?
Absolutely. If you
So
can
like,
create something that will work to help you track things on an ongoing basis and enhance what you already have within your safety program, absolutely yes. At the end of our questions?
I believe so in terms of questions I'm reading here. You posted your email as well.
Yes. Yes. So if anyone has any additional questions, please feel free to send me an email and I'll be happy to answer. And if that's the end of our questions, despite this being a really simple concept, I really hope that you do leave the webinar with some new or renewed knowledge and see the benefit of looking at risk mapping as another tool in your toolbox to help improve injury prevention efforts and strengthen safety culture. You know, my example with the one organization, they saw that huge turnaround in employee morale just because they felt heard. So it can help strengthen your safety culture as well. So I want to take a second to thank everyone for signing up and attending the webinar. And I'm going to give you back 11 minutes of your lunchtime. And I want to wish you all a wonderful remainder of the day. And I'm going to end with my email tagline, which is stay safe and lead by example. Thank you.